Alrighty. So, love, lust in the brain. I'm Rachel Dornianu, LPC, CST, BCC. I'm sure there's more credentials, but we're going to stop there. I own Sage Counseling and Wellness. A brief rundown. Let's just move this dang thing out of the way. I've been a therapist for over 7 years. I've been in the mental health field since 2015, so this is not my first rodeo. I'm an ASEX certified sex therapist. Basically, another acronym to add to my name. It's a ridiculous amount of training and hours and education, and I'm obsessed with talking about sex therapy, so why not get a whole credential about it? Specialties, like I mentioned a bit earlier, ages 16 plus, anxiety, boundaries, highly sensitive people, perfectionism, people pleasers, relationships, LGBTQ friendly, sex therapy, that kind of thing. I've got an office in Cumming, and I do, depending on the weather, an outdoor walk and talk kind of style of therapy, just because anyone that's 16 plus probably needs some fresh air and a change of scenery if they're sitting all day, which is, I think, all of us. I think we all need a walk and talk. And then if the weather's kind of crappy, then we'll just have an office session, and that works out well. So, things we're covering today, the agenda, if you will. We're going to be covering how the brain drives connection and intimacy, why desire looks different for everyone, the importance of brain and body health in sex, and tools for communication initiation, healthy things. So, if anything, I know we're all trying to have a time crunch of eating lunch and trying to network and getting a tour later. So, we're not going to have full discussions per se, but just take a moment to think silently to yourself of what brought you here today. Is there a reason you're like, love, lust in the brain? Why do I want to be here? Is a sexy topic helpful? But is it also because I want to learn something or I want to bring something to my clients or it's just a way to get a free lunch? Whatever the reason that you're here, just think for a moment about it. One thing to think about as well is how comfortable you are talking about sex or intimacy with a partner on a scale of 1 to 5, 5 being very comfortable. If you want to show a brief show of your number on your hands, you can. If you're like, absolutely not, I'm not sharing anything about myself, I respect that as well. I know for myself as a sex therapist, I'm a solid 5. Great. We got some vibes. Great. Oh, welcome to my people. Great. And then also, what about with a friend? Maybe as a close friend, you're probably a 5. If it's an acquaintance or a mom friend in the drop-off line, it might be a 1. Right. Exactly. And then with a therapist, hopefully you're around a 5. If you're not, find a new therapist. So things to think about there. So why the brain matters. The reason that I put this stuff together is one, we're working with Amen Clinic and they're professionals, experts with brain things. So why not cover it? But also the brain is actually the largest sex organ. Organ. There we go. No surprise. You can have fantasies, emotions, safety is connected to your nervous system, imagination and drive. It all drives arousal far more than the mechanics alone of your genitals and your pelvic floor. So keeping in mind, there's people that might have disabilities, things are going on for them, chronic pain, whatever, and their brain is easily still functioning pretty well. It's just their lower bits that may not. So being aware that your brain has got it going for you. Neurochemicals, the fun things to keep in mind and just throw out in fun to a session with a client. But dopamine is the reward and motivation. Oxytocin is bonding and trust. Serotonin is mood regulation. Testosterone and estrogen, the hormones, they are drive and desire. So basically, if you got a healthy brain, you got a healthy sex life. If we're not, we got things to work on. Making sure I'm somewhat in the frame here for this little recording. Cool. Love and lust. So the way I can summarize this whole thing is the bottom here. Lust gets us together and love keeps us together. So when you think about your partner, if you're in a partnered relationship, for the people that are listening later on, that you think about, I saw that person across the bar. I saw that person across the classroom when you were in high school. Wherever you found your partner, you're like, they're cute. Because there's like that 10-second moment of, this could be a thing, right? That we activated the brain's reward system. If anything, it's like addiction. Your brain is like, I'm obsessed. I want to pursue. I want to make this a thing. I'm going to make it happen. So the lust gets us together. It feels urgent, physical, sometimes impulsive. And then love is the bond, is sustained with oxytocin, vasopressin, and serotonin, activates the attachment and trust regions of the brain for the therapist in the room. I'm sure you guys do some kind of attachment theory often with your clients because that's where our field is going. We're having calm, stability, safety, deeper emotional connection. I maybe I'm just old school, but I think of like uh, Captain and Tennille of like love keeps us together. If that song helps to think about that, I saw some smiles of people that listened to that. Some people were like, "WTF? What is that song?" Look it up. That's somewhere. But both matter for healthy intimacy. Long-term relationships actually thrive when couples intentionally reignite lust while nurturing love. So when you think of the people that are having the relationships that have started to have a decline in their sexual intimacy, the passion, they're like, oh, I'm bored, or that's when affairs might be happening. That's when they're just like, I need something new. I need something fresh. That's when they might turn to maybe a midlife crisis of getting a car. How often do we see that in the therapy room? But also thinking about how can we get it to reignite in the relationship so that it's exciting again. I'm not saying go off to like a swinger club. If you want to, love it for you. But if that's trying a new position, if that's trying a new toy, if that's having a fun talk about something, sending a dirty sext, finding something to spice it up is really helpful. For those that don't know about Gottman's three phases of love, Gottman method couples therapy is something that I'm trained in. I'm obsessed with it. I've done levels 1, 2, and 3. I just have no desire to be certified. But it is very science based, which I think kind of fits pretty well with the Amen Clinic kind of stuff. If you haven't had a chance to look about into Gottman training, consider it. So there's three phases of love. There's limerence. This is when there's the lust that we talked about. It lasts about 6 months to 2 years. You're seeing your partner through rose-colored glasses. You're just like, oh, that thing, no biggie, little slap on the wrist, right? You are super infatuated with this person. And then there's the building trust phase. The excitement turns to security. Things slow down. You're more secure in the relationship. The real partner differences start to emerge. That's typically when therapy tends to kick in if people got married early in their relationship. And then the building commitment and deep attachment phase is that we're balancing desire and companionship, calm contentment, emotional regulation, acceptance. I think that the quote here, love evolves from excitement to peace. That sounds wonderful personally, but we also don't want to be bored. Peace can be still exciting. You have peace and then a little spark here and there. Okay, so body brain connection. The gut brain axis, nutrition, probiotics, inflammation, libido, things to think about because how you eat affects your body, your energy. If you guys are aware of spoon theory, if we're not taking care of ourselves, we definitely don't have energy to be intimate with our partner. So keeping that in mind. Circulation is obviously important, getting proper exercise, nutrition goes in there, sleep, stress, trauma are barriers to intimacy. If you don't feel safe in your body and your nervous system, it ain't happening. Don't even try. And then medication side effects, SSRIs, blood pressure medications. There's a ridiculous amount of medications that can affect arousal, desire, that whole thing. So if you guys want to probably hit up our doctors in the room and ask them questions later, feel free. But I think it's really important to keep a holistic mindset about things, not just here's a pill with Viagra and good luck. It's let's look at the whole shebang because it's important. Uh, this is probably my favorite thing that I've ever received as a gift from a client. They are a graphic designer. I was like, you want me to make a graphic design out of that? I was like, yeah, I do. Instead of just word vomiting all the time. So this is the window of tolerance. If you guys are aware of it, can you give me a thumbs up for my sanity? Okay, we got some and some not. Beautiful. Window of tolerance. How do I want to cover all this? Window of tolerance. I wish it was like, oh, there is. Does it work on the TV? No, but that's okay. So window of tolerance is when you feel grounded, present, adaptable, open, curious, somewhat quote unquote normal for yourself. If it helps to think of this window here, you're in that window. Yeah. Sympathetic hyperarousal. The way I think about sympathetic and parasympathetic, sympathetic starts your system. So sympathetic start, SS. Parasympathetic is pausing, slowing, relax and digest. So parasympathetic is to pause, PP. With sympathetic hyperarousal, you might feel anxious, irritable, hyperaroused, hypervigilant, impulsive, trouble with sleep and digestion, fight or flight response. We are just in full gear out of that window, right? I'm sure you guys have felt that before. I'm feeling it a tad right now because public speaking is not my favorite thing in the world, but we're making it happen. Parasympathetic hypoarousal. You feel depressed, lethargic, withdrawn, isolated. Again, trouble with sleep and digestion. Also, sex in both of these. If we're struggling in hyper or hypo, you're probably not in the mood in some way, shape, or form, unless you're on drugs. Then talk to our doctors. But with that said, the gray line here is showing a balanced nervous system response. You're still in the window. You have highs and lows. That's part of a normal part of your day, but it's still within that window. The gold line is the unbalanced nervous system. It's like an intense roller coaster. You're shooting up into hyper, crashing into hypo, or struggle busing. That's typically when people are going off to doctors and therapists, hopefully, if they're not, deep breathing and yoga are helpful. But with that said, if our nervous system is not in a somewhat manageable space, we're not going to be feeling sexy. Our arousal is going to be all over the place. We have things to work on. That's easily one of the first things I talk about with each of my sex therapy clients is covering foundational. If your nervous system feels safe, then you're ready to feel sexy. Safe is sexy. So I try and keep that in mind. Anybody need a screenshot of that before we good? Oh, we got one. All right. Anybody else? Last chance. It's a good one. Cool.
I have a question.
Please.
Are you going to send these slides to us after?
There will be a recording because we got this, and it'll go on my website, possibly a way to pass out from Amen, and then you can just go through the slides every day if you want. So reflection moment again, keeping it silently to yourself because of time. But where do you tend to operate in the window of tolerance? Are you in the window? If you are, I'm jealous, especially during the state of the world. Please share your secrets. If you're operating in hyper, if you're in hypo, or if you're just jumping back and forth between them, just take a moment to think about where you tend to operate. And then also take a moment to think about where your clients are and what they're experiencing. Do they tend to operate in hyper, hypo? Are they jumping around? Because if anything, using that breakdown, either verbally or a screenshot of the slide, that you can have a client just point and be like, that's where I'm at right now. And that's so helpful for them to have words to describe what's going on for them. So there's that. Fun facts. The clitoris has over 8,000 nerve endings. I'm sorry, what? That's amazing. And it's the clitoris is made for sexual pleasure and arousal. That's the whole purpose. Thank you, whoever made us. Absolutely. More than double what's in the head of the penis, so we actually get more sexy, exciting things than they do. Must be nice. Arousal literally changes the anatomy. If you are not aware of this, super cool. The vaginal canal actually elongates and the uterus tilts upward. It's called tenting to make space for penetration. So if you didn't know that about your body, now you do. The prostate is often called the male G-spot. It's a walnut-sized gland that can be stimulated internally, so it's about 2 inches toward the front of the wall of the rectum. So for those of you that might have male-identifying partners, prostate can be a fun thing to consider if they're open to it. Always, let me just say this, have consent first before you poke anywhere on anybody, and then we're going to be okay. Fun facts again, the skin is the biggest erogenous zone. So the brain is the biggest sex organ and the most important sex organ, but the skin is the most erogenous zone. Think of light touch, of warmth, of cold, of like a grip versus a tease. That pressure activates sensory nerves that release oxytocin and dopamine. So I always say do more foreplay than you think you need. To the people that I'm talking to clients, random people on the street, that you can do a whole lot just with your skin, which is super cool. Arousal and safety go hand in hand. I already talked about that. We want to make sure that we're in parasympathetic nervous system to have calm and relaxation. Emotional safety allows for more pleasure. One thing that I also do with clients all the time is having a pleasure map of figuring out where your hot zones are. So I'll get like a little anatomical drawing of the person and be like, when you think about it just off the top of your head, take 1 minute and put an X or a happy face or a whatever on the spots that are good for you, and then take it home and think about it. And from there, have your partner do the same thing and have their own little cutout and then swap. And then you can have them have like a little map that's made just for you. Maybe get it laminated for, cleanliness reasons. But besides that, it's really great to have that of like, okay, they're wanting something different. They want to have things spiced up. They wanted a blindfold. Okay, what do I do with their elbow? They said it was a thing. Oh, that's what they want with their elbow. Love it. So having a pleasure map is super fun. It's also good for them for solo sex and solar masturbation. That why not have a map for yourself? Pull it up right there. Oh, I remember that spot, right? So why not? Anatomy 101. I'm gonna run through some pain disorders because I don't think they're talked about enough, and they're surprisingly more common than you think. If you feel any pain, please talk to a doctor. Please talk to a therapist. It should not be painful. So there's something called genitopelvic pain / penetration disorder, GPPD. Why do they name it that? I don't know. I'm not part of the DSM. But what it is persistent or recurrent difficulty with vaginal penetration, pelvic or vulvovaginal pain, fear or anxiety about pain, or involuntary pelvic floor tightening that lasts at least 6 months and causes distress. That's a heck of a definition, y'all. It makes sense why it's such an encompassing GPPD diagnosis, but holy moly, that could be anything. So keep that in mind if when you're going through and assessing with people. I mean, one sim to me is the sex therapist, but if you're having to do some other kind of sex related work with your client that you check in, is there any kind of pain or fear or anxiety about any of this? It used to be called vaginismus or dyspareunia, but now it's all one cute little thing. Vulvodynia or provoked vestibulodynia. Ooh, say that 5 times fast. That is chronic burning, stinging, or irritation at the vulva or vaginal entrance lasting 3 or more months without a clear cause. Endometriosis, surprisingly really common and underdiagnosed, honestly. Medical condition often co-occurring with sexual pain is tissue similar to uterine lining that grows outside of the uterus, causing inflammation and pain. For those of you that are not aware of endometriosis, there's also often a type like PCOS, and there's often concerns with chronic pain, chronic inflammation, all of that. So things to think about and look at as you're talking with your clients. Let's see, next one, genitourinary syndrome of menopause. Is the thinning of vaginal tissues and decreased lubrication from lowered estrogen, leading to pain or dryness with sex. Surprisingly, for anyone that's even near the menopausal realm, pretty dang common, so things to think about. Peyronie's disease is curvature or pain during erection due to scar tissue buildup, which that's intense. For that to be every time that a client has an erection and they're in pain, ouch. Make sure they're going to a doctor for this. And there's chronic pelvic pain syndrome, pelvic, testicular, or genital pain not caused by infection, often linked with pelvic muscle tension or stress. That's a solid time to think about making some connections with pelvic floor physical therapist as well. Okay. Quick reflection moment in your head or a thumbs up. Were you aware of some of those potential concerns, diagnoses? Did any of those sound familiar, or you were like, what the heck was all of that? Yeah? A mixture? Yeah, absolutely. Until I got trained in all these things, I was like, you either have good sex or you don't, right? No, there's a million other things going on. So desire discrepancy. I think it's really important to talk about this because it is so much more common than people talk about. So partners don't always match in desire. It's actually pretty normal. The causes could be stress, stage of life, parenting, aging, emotional closeness. I think that sounds like normal life. And it's not about fixing, it's about understanding. For the therapist in the room, we're framing mismatch as a dynamic rather than a dysfunction. So it's just, this is what's going on right now. This is a snapshot of your relationship currently. It's things we're working on. We don't want it to be a diagnosis of, you just have different desires. We can play with that, and I'll show that in the next slide. The next thing, so there's spontaneous and responsive desire. Spontaneous is when you are able to have desire arising naturally. It's without an external trigger. You're just working through the day and bing, oh, I'm excited. I'm ready to go. I'm thinking about somebody, or I'm thinking about doing something or watching something later. Responsive desire is when you're in response to connection or arousal. So the things I've noticed is that it's typically more female identifying people that have responsive desire, and the male identifying is more spontaneous. I think you guys might have experienced that in society and TV, media, that is an expectation in society of male identifying people to be like ready to go or have it thinking about sex 20 times a day or more. I hear that all the time, but that's this expectation of men to do that. And then responsive, it might take a moment of like a nice back massage or a nice thoughtful appreciative note in your lunchbox or something that's just like, oh, yep, all right, now I'm in the mood. That sounds great. There's a cute little breakdown here from Couply.io. That desire appears before physical or emotional stimulation, feels sudden like a spark out of nowhere, is common in early dating stages or when libido's high, triggered by random thoughts, visual stimuli, fantasies. That's all spontaneous desire. Responsive is after emotional or physical closeness, feels after touch, affection, feeling connected, is more common in long term relationships or when under stress, and is triggered by cuddling, kissing, emotional bonding. Um, Silently think to yourself, is there anything else of where you think you might operate? Are you more spontaneous? Are you more responsive? Does it depend on the situation and who you're with? Sometimes one partner really gets you going no matter what and you're spontaneous. Another partner could be of where you're really responsive and it takes a minute. So knowing when you're at your best, brain and body signals of optimal readiness, there's energy, calmness, connection, being aware of mood disorders as therapists, doctors in the room, that there is a huge piece of anxiety and depression and ADHD that are at play. I went to something called Sex Down South years ago. It happens every September in Atlanta. If you guys ever decide to go to that, then let me know. And it'd be nice to have a buddy that's there. But they had a whole workshop about ADHD and intimacy of how, because I'm sure you guys are noticing more that ADHD is rampant, but also is all over TikTok. That everyone is self identifying themselves as ADHD. A lot of women that are adults are noticing that adult ADHD in women is actually a thing, and it's so different from male ADHD. So keeping that in mind. But back to my tangent about the workshop is that having ADHD while you're trying to be intimate, if you're not medicated and you're not working on mindfulness and other kinds of coping skills that are needed for ADHD, that is really hard to keep an erection, to keep the arousal going, to keep your head in the right headspace, to be able to be intimate. That some people are finding helpful tips of narrating what's happening to them in their head or aloud. That's helpful to keep that track focus on intimacy rather than, did I turn the stove off? What's the dog doing over there? Did the baby cry? That is oof. Okay, I'm noticing that my partner is doing this to my hair, this to my body, and that helps in terms of narration. So things to think about with your clients. Communication and intimacy. Let's see, what do I want? I could cover this for hours, you guys. Uh, so that pure curiosity, bless you. Why talking about sex is often harder than having it. I'm really curious. Like, I have some ideas from working with clients, but just full audience feedback. Is there anything you guys think about of why it's easier to do it than to talk about it?
I think stigma.
Stigma?
Like based on your like examples of what that communication was like growing up.
Mm-hmm.
I didn't talk about sex. Sex was not talked about to me. So
Right.
it's a conditioning. Like you learn that it's like taboo or like just not something that you talk about. So,
Mm-hmm. Absolutely. Especially being in the Bible Belt in the South, it's just not done. Or if you grew up in a conservative religious home, it is not happening. And then you're awkwardly going through high school of an abstinence only program, and then you get married and you're like, what goes where? That thing does that? Oh, it's wild. Because honestly, that's some of my clients is people from religious and conservative backgrounds figuring out I need adult sex ed 101. Truly. Like the puppets back there on the table, if y'all want to play with them, you're welcome to. They're really fun. But Jessica's like, these. That I will use those in session to have to show people how to interact with a vulva, interact with a penis, interact with a breast, any other kind of things. If you guys happen to have any connections of other puppet makers for other body parts, let me know. Those are just the ones I saw most common. Uh, they're all on Etsy if anybody wants to buy them. But it's so much easier to just do the act and just hope for the best and sit in pain and silence than to talk about it. So it's having to build the confidence to talk about it with a therapist, a friend, a partner, a religious leader, and go from there. Let's see. Communication intimacy. All right. Strategies, things I think about. This is another Gottman thing. So having a sentence equation of I feel blank when blank happens and I need this. So for a non-sexual example, I feel flustered when we're late to a dinner reservation and I need for us to be on time so I can be calm and enjoy our time together. So rather than I need to be early to look at the drink menu, you don't need to be early for that. That's a want. A need is a core need of why do I need this? If we're thinking intimacy wise, maybe same emotion of feeling flustered. I feel flustered when there's not enough foreplay and I feel rushed to be aroused, to be intimate with you. And I need for us to slow down, have more touch, have more kissing, have more fill in the blank, for me to feel more aroused and for anything to be lubricated enough for penetration. So thinking of ways to have that from an I point of view is going to be a lot better than you did that thing and I hated it. Your partner is not going to take that well. Please don't. Try and have I language. There's the acronym of BIF, which is brief, informative, friendly, and firm. It's keeping in mind that's the conversation, not the sexual act. That with that, it's being brief, concise, ways for the listener to be able to understand what you're talking about, being informative of what's going on, being friendly and kind, but being firm with boundaries as well. Repair attempts are so important. If you make a mistake, if you slip up somewhere, if you make if you say something that was just blurted out in the moment, be like, ooh, crap, sorry, my bad, and find a way to move past it. If it continues to be a concern, please have a conversation with your partner. But in terms of repair attempts, they can be humor, touch, gentle redirection. Are you guys aware of love languages? Lots of nods, yeah? Okay, beautiful. It seems like it's pretty well known at this point. A brief rundown for the people that are listening that may not know. They are, hang on, brain. I got two babies. I'm trying to get my mom brain through. They are receiving gifts, words of affirmation, acts of service, quality time. What's the last one? Physical touch. The whole reason for this conversation, guys. That one, physical touch. So with that, it's important for you to know your love language and your partner's love language of how you each like to receive it, but also how you give it. Because sometimes the way that you give a love language is not what you want to receive. Like my precious husband loves to give gifts. It's okay for me. That's not what I need, though. I need words of affirmation. So keeping in mind that you can communicate that in a biff way of gifts don't really do it for me. Can you be like, hey, cute butt? Okay. Erotic blueprints I'm going to cover in a second because these are like the sexy love languages. If you want to take a screenshot, highly recommend because it's amazing. And my sex therapist supervisor made this because she's a genius. So the erotic blueprints, it's originally from a sexologist and sex educator named Jaya. You can easily go on Google and find her and creep on her and love all of her things. I have her book. Amazing person. So there's energetics, sensuals, sexuals, kinkies, and shapeshifters. Brief rundown. Energetics love teasing, anticipation, and they want to want. They want things that are outside the box. It's not that sex is purely a physical act, but it's more deep, intimate acts. It's truly the energy. It's being excited. It's having an experience. The sensuals is using your senses. Anything that's those five senses is going to be an amazing experience for them. The sexuals is what's commonly known in society as what sex, quote unquote, is. So it's using touch, genitals, orgasms, intercourse basic sexual kind of things. The kinky is this anything that's edgy, taboo, a sexual outside of the box kind of interaction. If you ever go to Sex Down South or Frolicon, you will see plenty of that. Feel free to go on their websites and you will just have a ton of fun. And then shapeshifters, they enjoy a lot of everything. They are all the things. They are going to shapeshift between all these different erotic blueprints. They're just having a great time. They are quote unquote the hedonist, if you will. Of all the things I have just rambled off, think to yourself or feel free to share of what communication tips you would like to try or recommend to a client, something that you learned. Any thoughts so far? Yeah.
I have been thinking about those I feel statements a lot lately, and I just find it so hard to say them without sounding like you're criticizing.
Ooh.
You
Okay.
know?
Give
And
me an
that's like
example.
the whole point of the I feel statement,
Right.
but it's hard to say like I feel abandoned when you don't text me back.
Oh.
You know?
Can I tweak that?
Yeah.
Okay.
Please do.
So at first it feels robotic, right? It feels weird. The things that I've noticed that are helpful is keeping it as objective as humanly possible. Not of, can you repeat it? What it was?
Saying I feel abandoned when you don't text me back.
Okay, so I feel abandoned when you don't text me back. I feel abandoned when I don't receive a text. We're taking you out of it completely. Because that way it's not just you're doing that thing, how could you, and critical. Is anytime I don't receive a text, especially from a loved one, I feel this. And I need to have some kind of communication to make sure that you're okay. So being able to play with that can be helpful.
Okay,
Does that help?
Thank you so much. Yeah.
Yeah.
Because it's the when you that sounds, yeah.
The you piece
Right.
is tricky.
Right.
And anytime I'm working with clients, truly they're saying the same exact thing of, well, you did that. It's like, maybe they did. We don't know. That was your point of view and that was your experience. What we're going to do is find a way to take the you out of it and say just of what you experienced. Things to play with.
Thank you so much.
Yeah. Anybody else? Thoughts? Cool. Putting it all together. Brain, body, relationship, health. So the triangle model, if it helps to have a cute little visual, that brain health, body health, relationship health, we have to have all of them. If one is off, and intimacy is going to struggle. So encouraging a holistic perspective. If there's a need for medication, then considering that. Maybe there's a need for therapy, physical therapy, an adjustment to lifestyle, substances that are used or not used, things to keep in mind. Some of my favorite resources, I have some partnerships with these people, but it helps to know that I've actually tested them and I recommend them to clients. It's not just like, hey, here's this thing and I get commission. So Intimate Rose has dilators, pelvic wands, pelvic floor tools. Keeping in mind, I use these as demos. I do not actually use these on a client. I am not qualified for that. That's a pelvic floor physical therapist thing. I do not do sex work or body work in that way. Just big disclaimer there. New Flora has gut, brain, and microbiome balance supplements. And they also have all sorts of other pelvic floor tools that you can look at if you're trying to get a best deal between Intimate Rose and New Flora. Kendra has hormonal and menopausal support products as well as, brain, vaginal lubrication. Arousal oils. They have daily relief lotions for people that have any kind of that like vulvodynia, G-triple-PD kind of concerns and sensitivities. They have lotion, especially for people that are menopausal, premenopausal vibes. If there's anything dryness down there, they have lotions that are supremely sensitive, and they actually have daily relief serum that's for like when there's more intimate things that are going to occur. So I'm really impressed. Past that, practical takeaways, I think it's pretty safe to say that sleep, nutrition, and movement are foundational. That's just a basic human thing. If you're not doing that, please do. And then you'll just naturally see better things within your intimate lifestyle. Desire fluctuates. It's normal. It is not a pathology. Please make sure that you know that you share that with everyone you know, all of your clients, because it's just part of the experience. Same with the window of tolerance, that you're going to have highs and lows in your day. you're going to have highs and lows in your arousal, and your desire is going to change. And also keeping in mind the stage of life. If you're in high stress, if you're dealing with the state of the world right now, with the economy, with being a new parent, with having grief and loss, trauma, there's a ridiculous amount of things that can be chronic stressors on your life currently that are going to affect your desire. Learning your signals of readiness, communicating directly, kindly, and with humor when possible. The reason I mention humor is because that's my favorite things of ways to communicate. If I'm not joking and being playful, something's wrong with me, check on me. But it's also nice to make intimacy fun because it's supposed to be fun. I know that there's some conservative and religious backgrounds and organizations that say sex is only for procreation and that's it. That sounds horrible. If you're not having fun and having humor and giggling and maybe having like a gentle tickle or like a smack on the butt kind of thing, I wouldn't be aroused. I don't know anybody else that would. So find ways to have humor and have fun, encouraging curiosity and playfulness. I don't know about you guys, I love a solid case study because then it's be able to have actually applicable examples. So we're going to run through a couple case studies and then we'll hit resources and I'll gently kick y'all out. So, case study with desire discrepancy. I will read this off of the whole thing because it's tiny print. So, background: Sarah, 38, Mark, 41, married for 10 years with 2 kids under 8. Presenting concern: Sarah reports low desire and avoids sex. Mark feels rejected and worries something is wrong with their marriage. Tell me you have not heard this couple in daily life or in media, in your therapy office. Pretty common. Key insight: Sarah is mentally exhausted, sleep deprived, and hasn't exercised or slept well in months. Her brain is in survival mode, low dopamine and oxytocin. Mark's initiation style is physical touch, while Sarah needs emotional connection first. Therefore, you can see that Mark's initiation style is more spontaneous. He's just like ready to go. Sarah is more responsive. She needs that emotional connection first. So an intervention: normalizing desire discrepancy, validating both partners, encouraging scheduling intimacy during less stressful times, and practicing non-sexual touch to rebuild connection. I'm really going to encourage telling clients it's okay to schedule intimacy, whether that's cuddling, being actually physically intimate, whatever that looks like for you and your relationship currently, because we lead really busy lives. It's not the 1950s anymore of the traditional breakdown of one provider and one stay-at-home person with kiddos or no kiddos looking after the dog, whatever it might be. We're busy. We're slammed from when we wake up to when we crash in the evening. So if you're not scheduling, it's probably not going to be as good. If anything, it's like a quickie in the corner and there you go. Doesn't sound that great. And then practicing non-sexual touch to rebuild connection. If you're not used to having just like a handhold or a snuggle or a shoulder massage or like a hair tussle or something, it's going to feel kind of awkward and you might shy away from that. So finding ways to slowly build that back into your relationship is helpful, and being fun and playful and build from there. So takeaway: desire mismatch is normal. It's not about fixing one partner. It's about understanding how brain health, stress, and communication will shape intimacy. Any questions on that case study before we move on? Solid? Okay. Case study for pelvic pain. Maria, 29, recently married, comes in reporting pain with penetration. She feels broken and anxious. How many times have you guys heard that in your office? Yeah? So presenting concern: pain leads to avoidance of intimacy, leads to tension in the relationship. I see this all the time. So pelvic floor is hypertonic. It means that it's tight. Anxiety about sex activates the amygdala, and there's more muscle guarding. So there'll be tight, tense pelvic floor and less likely to be able to have any kind of penetration at all. And lack of education about clitoral versus vaginal stimulation. There's plenty of ways to spice things up down there. You don't just have to have actual penetration. The intervention: referring to pelvic floor PT, 100%. I work with pelvic floor PT a ridiculous amount because I have the education, but I'm not going to go up into somebody to do a pelvic exam to be able to actually test their muscles and be able to see what's going on in there. So that's when I would definitely refer out, providing psychoeducation on anatomy, arousal, introducing dilators, normalizing that she's not broken. The one thing I want to add about introducing dilators is that that's when I would do a demo of like, hey, this is what a dilator is. This is how you would use it. I would use it on my vulva puppet back there. Like, this is what you would do in terms of like movement. But I would still recommend pelvic floor PT to make sure that there's actual solid guidance from someone actually trained for that. The takeaway is that pain isn't just a body problem, it's a brain body loop. Education and pelvic health support can make intimacy safe and enjoyable again. Thoughts, questions on this one? Solid? Okay. And the last one is anxiety and avoidance. So James, 34, single, reports avoiding dating and intimacy due to anxiety and shame. Wants relationships but avoids them and is stuck in a cycle. Does that sound familiar for men or women that you're working with? Yeah. So key insights: overactive amygdala, constant threat mode, high cortisol suppresses testosterone and dopamine, which leads to low desire. The internal script is I'll fail at intimacy, so why try? For all of my perfectionist clients that I work with, holy moly, I see this all the time. I know some of you guys mentioned perfectionism in your intros earlier. Tell me you don't see that, right? It's a constant thing of whether it's intimacy, schoolwork, dealing with family, setting boundaries, pursuing school. It's so common. And so the intervention is CBT for anxious thoughts, mindfulness to calm the brain, gradual exposure to dating scenarios, working on self-compassion. I also think about ERP, so building exposure hierarchies. I do that with clients all the time, whether it's intimacy, social anxiety, what have you. I have training in it. I'm not an expert in ERP, but I think it's important. Is everyone aware of ERP and what it is and how it works? Some nod, some not so much. Cool. Brief rundown. Joanna, if you want to jump in, you're welcome to. But with ERP, it's exposure and response prevention. You're able to build exposure hierarchies of 1 to 10, 1 being like a candy wrapper on the floor, a little uncomfortable, and a 10 is like, I may poop my pants. Terrifying, nervous system's thrown off, it's not happening, right? So with that, you build a hierarchy, 1 to 10, and figure out the personal things that will throw them off based on that. And so with that said, there's something called SUDS, which is subject units of distress. And so you figure out how intense is that for you and your body and your brain and your emotions to experience that, and how do we slowly build new neural pathways and body experiences for this to be less scary over time. So that's exposures. It could be through doing imaginal exposures of going on a date. It could be hopping on a dating app and just talking to people without ever actually interacting face to face, and slowly building over time. Anything you would add, Joanna, to that?
Yeah. You want to evoke the distress, the discomfort.
Yep.
You know, just to learn that you can survive it and learn the positives associated with it, because you always tend to avoid things that you're afraid of. You don't learn that you don't have any sense of skill or mastery, or new learning can occur.
Mm-hmm.
So you just work your way up.
Beautiful. Absolutely. So with that, where were we? Interventions. Okay. Working on self-compassion. And then the takeaway, sometimes the barrier isn't desire, it's the anxiety. So brain-based tools and therapy can help break the avoidance cycle. Questions on that case study? Solid. Okay. Resources and referrals. I have an absurd amount of books, resources, Google Drive things, worksheets, whatever. Hop on that QR code. You can access all of them. But past that, some of my favorite books is Come As You Are or Mating in Captivity. You can find those on Amazon really easily. The therapy for resources and referrals, sex therapy, pelvic floor PT, couples counseling. Ideally, somebody that is sex positive is super helpful. For apps, some kind of meditation, mindfulness, relationship check-ins. I've personally been using something called, oh my gosh, I'm pulling up on my phone. I can't remember it for the life of me, but I've been using it every day and I'm obsessed with it. It's called Paired, and it's purple with a cute little heart. I wish, for people that are curious, it's somewhere in there. Enjoy. But it's an app that will have you and your partner have cute little challenges every day, whether it's about intimacy, parenting, dealing with family, boundaries, work, what have you, and has just cute little challenges. It's 3 questions a day just to check in, and you get to swap the answers with your partner and add cute little notes and comments, and then you can share that with your therapist later on. I'm obsessed. If anyone from Parrot is listening, I'd love a free year. But I think it's pretty cool. The Amy Clinic, obviously, the reason that we're all here. They have amazing resources for brain optimization. If we don't have a healthy brain, we don't have a healthy sex life. And then the mental health and wellness discounts, that QR code, highly recommend. If you have not gone in and taken a screenshot of that or a way to access that later, please do. You'll be able to hop on this for people listening this way in the recording. That I'll try and include a link in the show notes because I've got a ridiculous amount of discounts from different partners that are sexual wellness connections. So please hop on that. And then anything else? If you want to share out loud, what is your biggest takeaway from today? Besides free food.
It was all like just good information and like refreshers and like different perspectives to bring into like our personal lives and to help our clients. I think the last case study about anxiety and avoidance,
Yeah.
like the realization of how much your like mental load impacts your intimacy.
Mm-hmm.
And I think it was something I was reading or listening to where it shifted the perspective of like it always not being so outcome based but enjoyment based.
Yeah.
And so that like changed the game for my life and
Oh,
my partner.
good.
And so that statement of I can't remember what it said, but I'll fail at intimacy, so I try.
Yeah.
I think we attach like a good experience with a good outcome, whether that's orgasm or climax or like whatever the case may be. But if we can just stay present enough, we'll get there.
Absolutely.
The enjoyment piece of it and not like anticipating, is this going to be good?
Mm-hmm.
And bring it back to like, let me just focus on how good it is right now. And then, so that like,
Beautiful.
that piece of it, the anxiety and the like mental narratives that are happening. And then the tool about narration for people who may experience ADHD, that was really
Oh,
a good takeaway
good.
for me because I haven't thought about that as like a helpful tool for someone.
Yay.
Yeah.
No, I'm so glad. One thing to comment on is that Dr. Emily Nagoski, she's the one that wrote Come As You Are, that I highly recommend for everybody to read. Her mention, you tell me if it fits, is that pleasure is the measure. It helps you remember that if that's what you're measuring. It's not that did you hit orgasm or climax or not, it's did you hit pleasure, and that's important. Yeah. Please.
I started following the podcast of Come As You Are.
Yeah.
And I stopped for a minute and then it just restarted.
Mm.
And the latest episode was about cannabis.
Oh, yeah.
And I thought that was, I need to go back. There was tons of information from a researcher who was studying cannabis and related to sexual pleasure.
How fun.
Very interesting. I need to go back and listen, but I just finished it.
No, thank you. I now have homework, so thank you. I'm gonna go listen about cannabis and intimacy now. Thanks. That sounds fun. Anybody else have any thoughts? Please.
You have clients coming to you often knowing this is what we're going to talk about. But
Oh, yeah.
something that came up about just the reality of normal life and day to day, how much sex conversation is avoided or taboo or like not appropriate. I'm thinking about clients that I'm working with that I can tell it's a part of what needs to be brought in the room, but it's not. And any guidance around outside just naming like, hey, let's talk about sex, but breaking that barrier of like the client or maybe me even having angst around who's going to be the one to break the ice to
Sure.
like, into the room.
Yeah. Oh, plenty of ideas. Okay. Things I think about. Ideal utopian world is that you're covering some kind of sex something in an intake. The reason I say that is that you go ahead and start that at the foundation of like, hey, by the way, I will ask now and then about this. Be prepared.
Sure.
That's a gold utopian standard to me in my brain. But past that is because I like to use humor, I will mention things to clients. I mean, they know what's coming because I'm a sex therapist, but I'll be like, let me tell you this fun thing that I heard on a podcast, or let me tell you about this thing that another therapist of mine did this weekend. Feel free to just throw me under the bus and just be like, my colleague Rachel has a vulva puppet. Do you know what that is? Let me show you. What do you think about this? Is that wild? Is it crazy? Is it cool? How do you feel about it? And then you've already opened that door. So anytime that you want to be like, oh, when you talk to Rachel and the sex therapist, but because it's a lot easier to have a fun fact or something to throw in rather than, how are you today? We normally talk about your depression, but how's your sex life? Right? Like they're going to be so thrown off.
Yes.
Wouldn't recommend. So finding a way to throw in something fun, something silly, a fun fact or something that you saw on TV, especially, gosh, like what was it? What's that show? Hunting Wives on Netflix. Y'all, that is a spicy show.
Yeah.
Wow. If you've not watched it, do not watch it with your parents. But I will say that if you're looking for some kind of visual, that'll be great. But you can be talking to a client. Did you see Hunting Wives, the recent episode? What do you think of that scene? Solid way to bring that in.
Awesome, yeah, thank you. I think there's a little bit of like, especially the clients I'm already working with, right? It's like,
Right.
who's gonna be the one to break the ice?
Mhm.
Type of thing. So,
Did you know Brittany Snow was your
Right? Exactly.
That was my pick.
It's shocking, but so fun.
we let people watch Hunting Wives.
Yes. Any other thoughts, questions on anything? Oh, we got more. Let's go, guys. All
Can
right.
I just intervene one
Please.
Because she has a 1 o'clock client. I don't want to hold her.
Yes.
Roxanne's our winner of our raffle. So just
Yay.
And that way her client's not upset with her.
Perfect.
Thank you.
Sure.
Okay, sorry. Now continue the great discussion.
Yeah, please. Charlotte?
Yeah, I was just wondering if there was the next level
Mm.
to talk about the engagement of the perimenopausal, menopausal woman and the anxiety, depression, ADHD aspects of being intimate, and then the benefits of regular intimacy for reset. It's like brief that I've heard about it. And I'm like, I really want to know more. One, because I'm right there
Yeah,
at 45, but also because I think that that's kind of a little bit of our bread and butter when it comes to who's coming to counseling.
Mhm.
It's those 30-year-old women, 30, 40-year-old women.
Right.
And yeah, so I was just wondering if you were going
Can I
to
share
do more on that.
Yeah. What's up?
Can I share something on that?
Sure.
The International Council on Active Aging, it's ICAA.org,
Okay.
and they have, for older adults, they have talk about sex, about intimacy, about what happens as you age, all of those things that you were just talking about, they do have information about. That's not specifically what their niche is, but they do have resources and scientific studies on it. So,
Thank you.
Mhm.
International.
International Council on Active
Active
Aging.
Aging.
They're out of Canada, and they're
Okay.
wonderful.
Highly recommend. I've been to some of their conferences. They are very thorough, very science backed. So they're lovely. And then past that, honestly, I want to connect you with my new associate, Julie. She just started 2 weeks ago, and she's killing it. Specializes in perimenopause, menopause, empty nesters, and then one of her children has ADHD as an adult child. I mean, she literally knows all the things you just talked about. So I would much rather have someone that has lived experience and actual training in that for you to speak with. So homework for me, I'll connect you. Anybody else? Thoughts, questions before we wrap up?
Just
Solid?
one other thought.
Yeah.
It's so important about having the sexual part of your being for you to talk about with your clients. I mean, I'm not a counselor, but it is so don't separate it. Don't let it be, start changing it to where it's not, taboo. So it's just so important as being part of your whole wellness, mentally, physically, socially, spiritually, all of that is included in there. So.
Mhm. Absolutely.
Sorry.
No, fair. Okay, let's see if there's anything else. So we talked about questions. And as a thank you, there's 2 websites. So I've got my therapy website, Sage Counseling Therapy and Wellness.com. That's probably the longest domain name I could possibly find. And then rachelgordiano.com. That's more of like my yoga, speaking, coaching. I do business coaching and life coaching, sex coaching, I don't like to be bored, obviously. So I've got both websites, and then on most social channels as Sage Counseling and Wellness if you want to follow and connect. So yep, that's me. That's the talk. Okay, and thank you for listening.